Welcome back, guys. Today we are going to see how to assess dehydration and categorize them according to the signs and symptoms. So dehydration is categorized into two. We have no dehydration. We have some dehydration, and then we have severe dehydration. All these has their own signs and symptoms. So let's start with the condition. We are going to see condition. If someone is well alert, if someone is restless, or irritable, lethargic, or unconscious. So this one, if someone is well alert, there is no dehydration. If someone is restless, that person has some dehydration. And if someone is lethargic or unconscious, the person has severe dehydration. Now, from condition, let's see the eyes. We are going to see the eyes. How the eyes is the eyes appearing normal? Is the eye sunken? Or the eyes is very sunken and dry. So as in one, this one is no dehydration. This one is some dehydration, and this one is severe dehydration. Let's go to the tears. Is the tears present? And absent? And then the order is still the same as in above. This one no dehydration, some dehydration and severe dehydration. And this one can be combined with other signs and symptoms. And then let's go to the mouth. Mouth and tongue. Is the mouth moist? Is it moist? Is it dry? And then very dry. So this one also has no dehydration, some dehydration, and then severe dehydration. Let's go to the taste. If some thirst, is the person drinking normally? Drinks normally. The person is thirsty and eager to drink. The person drink poorly or not able to drink. So this one no dehydration, this one is some dehydration, and then this one belongs to severe dehydration. And then let's go to the skin pinch. skin pinch. So is the skin pinch going back very fast? Goes back very fast? Goes back slowly, and then goes back very slowly. So now, in this case, you need to know how to categorize all the signs and symptoms and where they belong. Goes back quickly, very fast, there is no dehydration. Goes back slowly, there is some dehydration. Then goes back very slowly, there is severe dehydration. And then in this case, you need to ask some questions. And those questions are the presence of blood in the stool. One, then you assess for malnutrition. Then you ask for how long the person has been passing loose stool. And then how many times in a day. This one will help you to guide you for what kind of management you need to give. And then you ask for history of fever. And then this one you need to take the temperature and you record it. So if you see the person has two signs from each category, then you can categorize it accordingly, or have one of the sign that qualifies to be in the group. Like, for example, if someone has skin pinch is going back very slowly, then this one you need to categorize it under severe dehydration. Though the person is taking eagerly. So, remember, all the people will not have all these signs and symptoms. They will have 2 or 3 or 1. So now that one make you to judge accordingly. In summary, assessment for dehydration, we look for condition and we see if the person is alert, restless, or lethargic. And then we come to the eyes. This one is the eyes. And then we see if it is normal, not sunken, or the eyes is sunken, or very sunken and dry. And then we come to see the tears. If the patient is crying, the child is crying, we see present and it absent. Then we come to the mouth and the tongue. The mouth will be moist, dry, and very dry. We see according to the individual. And then we see the thirst, how the child can take. This one you give the cup to the baby and you can see if the child is drinking eagerly, drinking normally, or drink poorly, or not even able to drink. Then you come to the skin pinch. You pinch the skin and you see how it goes back and the time it takes to go back. And then you make your judgment accordingly. And then other question to ask, present of the blood in the stool, and then you see for malnutrition, and then for how long has the child been passing stool, and then you see the history of fever, you need to take the fever. Now, in making the diagnosis or to categorize it well, you need to now have two signs and symptoms, then you come up with your diagnosis, or one severe sign that belongs to the certain category. So that is all. How do we manage now dehydration? Dehydration is managed according to the plan. Consider subscribing if you get any value out of this video. Thank you for watching. See you in the next one.